Hi, everybody. I am Kay Matthews. I am the founder of the Shades of Blue Project. I am a community organizational partner with 2020 Mom. I also opened up the pre-forum with our Inspire Method training. It is designed to help break cultural barriers in maternal mental health. Today, I have the pleasure of introducing Dr. Lustig. He will explain why loneliness is a critical emergent issue and how loneliness is linked to maternal mental health. Dr. Stuart Lustig is currently the National Medical Executive for Behavioral Health at Cigna. In his client-facing role, he engages with clients, provider groups, and other stakeholders about Cigna's behavioral health care business. He also manages a team focused on addressing individual customer grievances of importance to Cigna clients. A board-certified child psychiatrist, he previously served as lead medical director for child and adolescent care for Cigna's behavioral health business. He leads an ongoing effort at Cigna to disseminate health services research via peer-reviewed journal publications and presentations at conferences. These efforts have recently yielded several peer-reviewed publications. Cigna has also recognized the teams led by Dr. Lustig that contributed to these initiatives with Cigna's prestigious Quarterly Champion Award. Please welcome to the stage Dr. Lustig.
Thanks very much. So just a reality check here, folks. It's 3:30 in the afternoon. I want to thank the organizers for not making me the after lunch speaker, at least. Although I, for one, am still recovering from the 5 mountains of guacamole that I ate with a whole bunch of those Dove Pillow chocolate chasers. Delicious. I see a few empty seats. Most people are still here. It does feel just a little bit lonelier than, than before, but we will get through this. Now, you may be thinking, what does loneliness have to do with maternal health? And I want to answer that question, first of all, by showing you. I think a visual will be helpful here, so let me just pull this up. So this is a picture of my daughter there. She's the one on the left, which you can all clearly see. Even those of you guys back there in the cheap seats, you can see her. And you can tell from the photo that she's half Asian. And the reason that's important is because my wife's from China, and in Chinese culture, it's very common around the time of a birth for the extended family to come and help out. And so her parents came, and they cooked, they cleaned, they did everything. The only thing we could not get them to do was breastfeed, but they did everything else for her. And then when they left, it was just my wife and I and our nonverbal daughter just kind of looking at each other. And it was actually a pretty lonely period, particularly for my wife, who had not gone back to work and didn't, fortunately, for a couple months after that. And I will tell you that when you are my age, I know I look about 26, but I'm actually a few years older. But when you have kids when you're 26 or 32, everybody's doing it, right? I mean, everyone's having kids. And they... you've got a whole cadre of people to support you in this, because there are a whole bunch of new moms just like you. When you do it when you're in your late 40s, people look to you with gratitude because they can give you all of their hand-me-downs, but that's about it. So very lonely experience. And so I want to talk about loneliness in the study that we've been doing at Cigna. We've been very interested in loneliness, and I'll talk a little bit about loneliness among moms as well. And you might ask yourself, well, why would a company like Cigna, which is interested in health services and products, be focused on loneliness? And the answer is simply this, that when we look at the literature, we find that loneliness is related to a whole host of psychological and physical problems, and whether it's stroke or heart disease on the medical side, as it were, although, as we know, body and mind are connected, but just to create an artificial divide, or whether it's depression, anxiety, dementia on the psychiatric end of the spectrum. Loneliness is a common theme that is associated with all of these things. So anything we can do to understand this phenomenon better helps us take care of people. And so we have done 2 waves of studies, and I'm going to show you just a few slides to highlight some of the data from these slides. And there are 3 numbers on this page. 61%, which is the number of people in our survey this time around who identified as lonely using the UCLA loneliness scale. And this was based on 10,000 Americans ages 18 and up across the United States. This was 7 points higher than the number that we got about a year and a half ago when we surveyed 20,000 people in our initial survey. So people were, a significant number of people, over half, were lonely then, and we see more people who are identified as lonely now. 24%, and this is the number here, that say that their health is fair or poor. Now, this is a self-report measure, but the reason that this is significant from the standpoint of loneliness is because this variable is associated with loneliness. If you believe your health to be fair or poor as opposed to good, very good, or excellent, you're more likely to be lonely. And the final number, 90K, that's the number of hours that we spend over the course of our lifetime at work. And I know what you're saying. You've done the calculations in your head right now. You're saying, I work way more than that. Probably everyone in this room does work way more than that, but assuming a 40-hour week, 40 hours, right? But assuming a 40-hour week, that's the number that you come up with. And we focus particularly on loneliness among the workplace and among people who are working and in the workplace for this study. So let me show you just a few more numbers. I'm going to go to the bottom two, because I think those are the most interesting, quite honestly, and most compelling and robust. What we found in terms of age was a repeat of what we found last time. And this was a very surprising finding. Every time someone moves into a different generation, they get less lonely. So the youngest people were the loneliest, the people who are 18, 19, 20. By the time you get to be 70, let's say, your grandmother, who may seemingly be isolated and no one's visiting her anymore, and she's not on using technology in the way the young people are, but surprisingly, older people were less lonely, and there was a monotonic decrease in loneliness, every single generation being less lonely than the one before. Now, I think in some ways that's a good thing, because it says that there's something about our ability as we age, or at least maybe before the onset of screens everywhere, there's something about our ability to figure out how to connect with people and have meaningful connections, even if we don't necessarily have someone right beside us. But the social media piece of this was interesting, and this is worse since the last study that we did. And think about this, because when you're home alone, perhaps, with a new baby, and you're trying to figure out how to connect with other people, you may be relying on social media. And we heard a lot of very good opportunities in a recent lunch about how technology could help connect people and get people services. But here are the results of our study, that the more you use social media, the lonelier you are. Now, this is different from the previous study, because the previous study that we did, we found that there were heavy users and light users of social media. And although there were some nuances that we sorted out in the paper that we published in the American Journal of Health Promotion back in June, by and large, the amount of social media didn't seem to predict loneliness. What was associated with loneliness related to social media use was this. It was whether or not you thought you were using social media too much. Right? Think about it. So if you're that kind of person who thinks, geez, maybe I'm spending too much time on the screen, well, guess what? You're right. So, and that's a good thing, because that means you at least have some degree of insight into this. But this was one of our findings. I'd like to share with you just a few others here. Let's talk about women and loneliness in particular. And I'm going to scoot over there to the right side. It's hard to read. This says, moms of children under 6 years old and 12 to 17 years old are the loneliest. Now, we weren't able to look specifically at the peripartum. Sorry, I'm going to stand back here. So, although I'm nice to look at, I know you're trying to see the slide. So, although we couldn't quite look at the peripartum period specifically, that's included in this 0 to 6 group, right? So, if your kids are from 0 to 6, that is a lonely time for moms, and perhaps as kids get more independent and go off and do their own thing and discover social media with a vengeance when they're teenagers, that's also another lonely period. Not surprising if we look at marital status, that widowed moms are the loneliest, with 76% of them identifying as lonely on the scale that we used And those who are married are the least lonely, and other permutations of marital status fall somewhere in between. And then I'm not going to put too much stock in this middle number because it's not a huge difference in the scores, but I did want to show it to you at least, which is moms working outside the home being lonelier than moms who stay at home. So something to think about, particularly as we're very focused on the work environment. Lots of data about the work environment we could talk about. Let me just share a few things that Cigna is doing. So quick commercial alert, but I'll keep it brief here. So we've talked a lot about expanding access and capacity, and we'll probably talk a little bit about that in the next panel. At least I will if I'm invited to, or even if I'm not. We have a support line for veterans as well. A lot of them are isolated and lonely too. And then there's some things specifically focused on kids. So one of the things is a recent $3 million grant that Cigna has committed to, and this is part of our $25 million commitment over the course of 5 years to support mental well-being in schools. Now, there's not a specific program or mechanism, so funding alert. If you know any organizations, if you're part of an organization that works with schools, have them go to our website, specifically the foundation, so they can see how to put this money to good use. And finally, a school support line. So as someone who has worked in schools or with schools for many, many years now, I can tell you that school psychologists, guidance counselors are overwhelmed. Their caseloads are enormous, the needs are very complex, and so anything that we can do to take a little bit of burden off of them and get them into, and help get kids connected with a compassionate clinician on the phone, potentially a good thing. All sorts of legal issues to figure out on a state-by-state basis, issues of consent, issues of parental involvement and where the service is delivered, but we can get past all that and get to the good stuff behind this offering. So. A few other things I'd like to share with you. Important in our study, in both studies really, if you look at the lower right, work-life balance, those people who say they have a good balance are less lonely. This is comparable to our previous study in which people who said they got the right amount of sleep as opposed to too little or too much were less lonely. People who got the right amount of exercise as opposed to too little or too much were less lonely as well. And people who, again, were physically healthy, as I mentioned earlier. The one thing that was interesting is there was no such thing, if you look at the amount of money that people make, did that match up to too little, too much, just the right amount? No, it did not. So they say that money can't buy you happiness, but our previous study showed that money can buy you friends at least. And people who were less lonely tended to make more money than people who were more lonely. So not a cure that all of us can necessarily access right away, but helpful to know. At work, since this was a work-based study focused on what's going on in the workplace, I'll share these results with you just quickly because I know we have a panel coming up in just a couple minutes. But if you were unemployed, you were the loneliest demographic in our group. Except for, again, the very young people. And relationships with coworkers mattered. So if you had good relationships with coworkers, you were less likely to be lonely at work. Part of building those relationships is being at a specific place for a particular time. So newer workers were lonelier than workers who'd been there for a long time, for example. Older workers were less lonely than younger workers, and so forth. So it's interesting seeing how these variables all come together. As someone who works at home, and many of us at Cigna do work at home, again, the just right thing, I keep thinking of Goldilocks and the Three Bears, which I've read to my daughter for the last 6 nights in a row. It's kind of the just right thing again. If you are telecommuting or working from home the right amount, you are less lonely than if you think you are commuting too much. Telecommuting, that is, or not enough. So again, remember, just right is how to prevent yourself from being lonely. Importantly for employers, and this is the part of the information that we share with them, lonely workers rate themselves as less productive, less likely to stick around, and more likely to take sick days or days due to stress. So there's a real cost to an employer of employees being lonely. So things that you can do, recognizing in others when they're lonely, asking people, making connections. The most basic thing you can do is having meaningful face-to-face interactions with each other. So at work, that may be stopping to have a conversation with someone who works in the office next to you as opposed to sending them an instant message. So face-to-face interactions. Coming to events like this is important because this is how we network. This is how we, yes, indeed, this is how we make connections that matter with people who care about the things that we do. At work, you can volunteer with others. You can exercise with others during lunch. All sorts of things to do to make those connections. Even basic things. The person at the convenience store down the street from me probably hates me by now, but I make a point of greeting the cashier every time I buy something there, and not in a creepy way, like I don't hang out for 10 minutes while there's a line behind me, but just to have that momentary personal communication with someone, so it's not just a brief transaction.